Hi, this is Cassidy Richards, and I'm here today to do a IV, and we're gonna hang a saline drip as well. I have my orders. My patient's name is Ivy Needed, and she is allergic to penicillin and latex. Today I am going to make sure and do my 6 rights of medications. Right drug, right route, right dose, right documentation, and right time. And I will do hand hygiene. And I would come in to the room, make sure they're at a good height. I've already raised my table up to make sure it's at a good working height for myself. This is going to be Ivy. I will verify her with her name and date of birth, which she would do. And then I will double check my orders and make sure that I am doing the correct thing, and my orders indicate 1,000 mils of saline to infuse over 6 hours, and my hourly rate will be 167 mils an hour. My drip rate will be 28 mils an hour. So since I have my orders, I will come in and talk to my patient, let them know I'm going to be doing an IV. I'll put my tourniquet on, and this time for this tourniquet, I'm just going to be looking for a vein. So once I've found my vein, which would be this big one right here, I would release the tourniquet so I could prep everything else. So lay that down. I want to get my catheter ready, keep it sterile, but get it ready so that when I go to stick it in, I have everything ready that I would need. I'm going to set my orders over here. And I am going to make sure that everything is just opened up. And then I'm going to open up my bags. So I've got my 1,000 mils. And as I'm opening this, I'm going to document the name, time, and date of birth of the patient on the bag. And I'm going to hang this up on here. Maybe. There we go. Hang this on here. And I'm going to get my tubing out. And this tubing does have a drip rate of 10 drops per mil. So I'm going to keep this aseptic. I'm not going to touch this portion that has the cap on it once it is opened. First, I'm going to clasp this so it doesn't leak everywhere, all over the floor. Release this, and then I'm going to go over here and release this portion. Slip that off. Inject my spike. Perfect. So the tubing also will have the patient's name and date on it so that we know it came from which patient and it doesn't get used again. So now that I have that set up, I'm going to release, make sure that all the bubbles get out of my tubing. And I'm going to press this so it fills. Press it again. It should be about 1/3 of the way full. Once it starts dripping pretty good, I'm just going to shut that off. Okay, so this still has the cap on it, so it is good to be set aside so it can be ready to put on the catheter. I'm also going to be opening my flush. As soon as I put the IV in, I will need to flush it, so I want to make sure that this is prepared. So I'm going to take the cap off, pull it back, get the air out of it, put the cap back on so it's still sterile, and put it to the side. I'm now gonna, I would wash my hands and then I would put gloves on. As you can see, I already have my tape ready to go. So here I am. I'm gonna put my tourniquet back on. And have it so it's an easy release when I'm ready. On it nice and tight. Okay, so now I'm gonna swab. I also have the pad underneath in case I get some blood, because there's a good possibility of that. So I'm gonna swab the site, going around the circles. Perfect. And I am now going to insert the catheter. This is the fun part for some people. So I'm gonna take my top off, and I'm gonna get to a good location, and I'm gonna come at an angle into the skin. See if I get a flashback. Not quite. Let's try a little bit more of an angle. Maybe. There we go. I got a little bit of a flashback, if you can see it in there. I'm gonna thread. I'm gonna leave my catheter in, and then I'm gonna pull my tourniquet so that I don't blow the vein. Don't blow the vein. I'm gonna thread the catheter in, and it is already starting to come out, which is a good sign. That means that it's still in there. There we go. Thread it back. I'm gonna hold it so that it doesn't bleed everywhere. Get the needle inside, locked. And now I'm going to take my Luer Lock tab here out of the package. This is why I opened it early. Get this off of it. Screw that on. Perfect. So now it can bleed all at once, and it should be okay. So for comfort, we put the gauze underneath, and I'm just gonna fold it in half and stick it under so it doesn't rub on the patient's skin. And so now that I have that, I'm going to take my tape that I've prepped, and this one's gonna be too long, but I'm gonna just cut it in half, and I'm just gonna tape sideways over it, and then sideways over it, just like that. So now that that's done, I'm gonna get this needle out of the way. I don't want it anywhere. And I'm gonna cover this with a Tegaderm. The Tegaderm I would have prepped with the patient's name and time. And maybe if I can get it undone. So I'm gonna make sure that this goes on, but isn't gonna cover the port, so you can change that out. Just like that. Just like that. Okay. So now that that's on there, I'm ready to do a flush. My flush is ready. So I'm going to just flush that through and make sure. The orders did state to have 5 mils. So I'm only going to do about half of this flush. Make sure and screw it on up there. And it is going, filling up my blood bag like it's supposed to. All right, so I have done the 5 mils. I'm gonna take this off and sharps it. Awesome. So now I'm going to connect my IV bag, which is right here. Maybe. Pull my cap off. There we go. Insert that onto here. It screws on. And now I have a second piece here that I'm gonna just tape this on across like this. Easy access. And then it would go up the patient's arm. Like that. Make sure that my drip rate is going at the correct time and speed. I would make sure that it would be dripping at the 28 drops per mil or 28 drops per minute. Which it is doing. Awesome. Thanks. I'll be back.